Heart Month comes to an end. The mission to educate and empower people, especially women, to focus on their cardiovascular health continues daily for the American Heart Association. One of its ambassadors and veteran nurse is sharing her story in hopes that it encourages others to take control of their heart health. She's a gem and an inspiration wrapped in one.
I love, being able to help someone.
Registered nurse Ruby Hope's name is fitting for her personality, but her gift of giving at times has left her running on empty.
As nurses, we do have a tendency to take care of others before we take care of ourselves.
Her first health hurdle came when she was 27 years old and pregnant with her son. Ruby was diagnosed with gestational diabetes and a year later found out she had type 1 diabetes.
And I've been on insulin probably for about the last 30 years or so.
She says she also battled with her weight, often on the go and reaching for the wrong things. Ruby was diagnosed with kidney disease and put on the list for a transplant.
I was turned down at first because my BMI was too high. I've always struggled with my weight all my life.
It was time to get serious. Ruby shed about 80 pounds in an effort to take control of her health.
Thanks be to God, I was kicked off the list because my kidney function returned. I got more kidney function because of the weight loss.
She says walking has always been her exercise of choice, and while getting those steps in, she was met with yet another health hurdle.
Oh, God wasn't finished with me yet. And I was walking in the neighborhood, and I had this odd feeling.
Pain in her wrist, unusual sweating.
What really got my attention was I had this overwhelming feeling of doom. And I did the one thing I should not do. I went and I sat on the sofa and I fell asleep. Right. Do not do what I did. Go to the emergency room.
During a doctor's appointment the next day, Ruby's doctor did an EKG.
You're not going home. You're having a heart attack.
A quadruple bypass, and 5 days in the hospital later, she was on the road to recovery again and back to providing more hope and counsel.
I tell people, eat less, move more.
Ruby says, be intentional about your health. Know your numbers and make sure you're making those annual appointments, controlling what you can. A good slogan, right? Eat less, move more.
I could use
that. Good reminder for all of us there. Ruby says it's been 10 years since she had that heart attack. Right now, she's still battling her kidney disease. She is going to be put back on the list for a transplant. So we are wishing her well. She says family history is such a key factor here. She had diabetes, heart disease in her family, and of course was putting everybody else first, herself last, and you pay the toll for that. So she's just reminding everybody, know your family history, know your numbers, your cholesterol, your BMI, all of those things, because there's a lot of things that you can control.
Reminds me, I need to schedule my annual physical coming up here soon.
Move more later
move
today.
more. That's right.